Hi everyone, I'm here with my new friend Dr. Philipose from Oklahoma.
Oklahoma City.
So he came here today to learn EBOO. What was that like?
Oh, it's wonderful. Yeah, Ozone's the best thing on the planet. And so I wanted to watch how you did EBOO and your technique and stuff. So I love learning and I appreciate you spending the day with me.
Yeah, and of course we have a very similar background.
Yeah.
You're a chiropractor actually,
Chiropractor
right?
by trade, yeah.
And you're lucky to be in Oklahoma.
Yes.
You can do a lot of things that chiropractors could never do anywhere other state, right?
Yeah, and we fight for that too. So
you're very politically active.
Very politically active. President of the association, and we just believe if we don't do it, then there's nobody else that's really going to start offering these things and make it available for our public, right?
Yeah. So it's really important that people support what you do.
Yeah,
right?
Absolutely.
Patients as well as other.
Yeah, other doctors. The Ozone doctors especially, it's almost like a family now because we all kind of see the effects of post-COVID, a lot of the other autoimmune cases and things that people are looking for. They're searching these things out now.
Yes.
And the more we get together and support each other, the better it is.
Yeah.
The trainings and conferences and all that. Yeah.
How can people support you? Do you have a website where people can?
So we have a political action committee that we formed, and it's under okkairos.com.
okkairos.com. Okay.
And to emphasize, our main point is these treatments, these ozone treatments and PRPs and stuff are very important to the public. And Oklahoma did something where they tried to repeal PRP and try to make it a scheduled drug.
Yes.
And so one of our doctors actually filed a lawsuit, and that's in the Supreme Court right now. We're fighting things legislatively and going and educating, guys saying, no, that's not true. The minute you bring the FDA into something like that and you tell a patient they don't have rights to their blood, that's a slippery slope. And
of course.
You don't want to go down that path. And so, but a lot of it's just a matter of educating and getting in front of these people and donating and making sure that the education's there.
Yeah. And of course, this is important not just for the people in Oklahoma.
It's important for everybody.
That's right. Yeah. And
we had calls from other associations in other states that they're noticing the same thing, the pushback. And then the pushback, what also we've seen is it starts getting, the protocols get corrupted, and we want to keep this natural, we want to keep it healthy and right.
Yes.
And we want to keep the principles the same instead of watering it down.
Yes.
In another 10, 15 years, you don't know what's going to happen otherwise, right?
Yeah, exactly. Yeah, and of course, especially important for people of Oklahoma, but there's really, you get people from other states, right?
Yeah, we actually have someone flying in from Oregon, and our integrative practice is one where all the practitioners, medical PAs, NPs, we all have the same vision and the same goal, and we sit and we can debate and make sure that we have the best possible outcome from our patients.
Yes.
But that's why patients like coming in from other areas.
Yeah.
They search this out, right?
Yeah.
So they'll find you.
Yeah. But besides that, of course, if one bad policy passes in one state,
that's right. It trickles down.
Yeah. So we need to fight this.
Absolutely. Yeah. The more and national and local.
Yes.
Support is what we emphasize.
Okay, so
okkairos.com.
Yeah. Kairos with an S.
Yes.
Okay,
plural.
Okay.
Yeah. Yeah. Our association's a little bit more progressive, so we actually really do and teach all of these different things. So.
Great. Yeah. Yeah. I happen to be a member of the board of the Maryland Society of Integrative Medicine, so we do similar things, trying to improve the legal climate for doctors in the state of Maryland. But of course, this is, we would appreciate the support from other states.
Absolutely.
Too, because we have people flying in or traveling from other states as well.
Absolutely, we'd love to have you come speak and bring your knowledge out there too. So.
Yeah, we'd love to. And so now, one of the reasons, of course, or the main reason that you came here to learn with me is because we have the same Ozone equipment,
Yes,
right?
yeah, we have the same Ozone equipment. And
The Herman from
yeah,
Germany.
yeah, I love it.
I would say it's the best ozone
That's a
generator.
Cadillac of ozone machines, and
Yeah.
we it changed our practice and it changed our outcomes
Yeah.
all the way across. It's one of the best things we've ever done, and our patients after COVID that were having long COVID symptoms, I'll tell you, it's one of the best investments I've ever done.
Yeah. So it's very easy to convert or
Yeah.
modify the setup
Yeah.
to do EBOO,
Yeah,
right?
yeah,
As
so
you
it's
learned
very
today.
simple. Yeah, very simple.
And yeah, it's actually not that difficult to learn.
Yeah,
But we just talked about some of the things to look out for.
Yep.
And so you'll be well prepared.
we're all prepared for it.
To-
Yeah, I'm
to start
excited.
treating
Yeah, we're
patients
going to go
on,
back Monday and get
on
started.
Monday,
Yeah.
right? And yeah, very happy to meet you. And
Yes,
we have
absolutely.
so
Appreciate
much in
it.
common.
Absolutely.
We both have the Weber laser.
Yes. Yeah. Great stuff there too. Yeah.
And you do a lot of patient with cancer, right?
Yeah, we see a lot of supportive therapy, so high
Yeah.
dose vitamin C's and hyperbarics. We do ozone, and patients, especially after chemo, we see a lot of those patients because they just want to detox and
Yeah.
just get better. So,
Yeah. And you do a combination of ozone therapy
Mhm.
and some other
Yeah.
IV therapies for that as well.
Yeah. High dose vitamin C,
Yes.
things like that. Yeah.
All right. And then you're an expert in prolotherapy.
Prolotherapy, yeah. I love prolotherapy.
Prolotherapy.
Yeah, prolotherapy and prolozone. Same thing with the Herman. So,
Yeah.
yeah, we do quite a bit of prolotherapy actually in our office.
Good. And what little you shared with me impressed me. With you use peptides as well.
Yeah,
in
a lot of
injections and
peptides.
some other.
Yeah, good amino acids can't beat it, right?
Yeah.
Peptides are it's very popular, and we also I'm part of the men's clinic, and we always emphasize wellness with the guys, but the peptides in general for just well-being,
Yes.
it's amazing.
Yeah. I recommend peptides to my patients as well. As you know, a lot of them are injectable. Some are oral,
Yep.
right? What are some of the favorites that you've used in your
Injectables,
practice?
wise, it's BPC 157, of course.
Yes.
The TB 500
Yes.
is also one of our favorites. N80 and Samara.
Okay.
We've been kind of using a little bit more of the MOTC and stuff just
Okay,
to see
yeah.
what the results are, and it's pretty good. Yeah, some pretty good results with all that as well.
There's so many.
So many
Possibilities,
stacks, right? Yeah, you can stack them, and a lot of guys will try some for a couple months and they'll switch it, and
Yeah.
then they'll see which ones they like, and then they just kind of stay on it.
Yeah.
But I mean, it's healthy, it's natural, can't beat it, right?
Now we first talked on the phone many years ago. Well, many years. A few years ago.
A few years ago.
Didn't you mention you also treat patients with breast implant?
Breast implant illness? Yeah. Yeah, so my wife went through that.
Okay.
And ozone, if I can recommend any one treatment, ozone for the women that have breast implant illness after they're toxic, the best results. In a matter of 4 to 6 weeks, they're seeing a lot of the inflammation come down, and also doing things like vitamin C and glutathione support treatments. But the ozone in general, once they detox, I mean, they see the biggest difference. Acne clears up.
Okay.
You'll see some of the jaundice clear up in their eyes.
Yeah.
Fatigue, inflammation in general, like the body ache.
Yes.
A lot better.
Okay.
Yeah.
Yeah. It's a big problem, I suppose, right?
You know, it's kind of like autoimmune, right?
Yes.
One person can test positive for COVID or Epstein, or they won't have the problems, or
Yes.
the visually you can see,
Yes.
versus the next person, 9-day difference, right? And what we find is that those patients have a tendency towards an autoimmune disorder, and then they go to put a foreign object in their body, and their body just kind of rejects it, and they just start shutting down, and that's what we're seeing with those type of cases.
Okay. Good.
Because I mean, the minute they take the implants out, they automatically just feel better. Now we just need to, go
Yeah.
through the protocol.
It's almost, I would almost make the comparison with the root canals.
Root
right?
canals, yeah.
Patients can get very sick from root
Yeah.
canals, not realize it at all.
Right, absolutely. And then, but if you start tracking symptoms back, there's always that source, right?
Yes.
And it's just a matter of playing detective work, and that's why doctors like us we like playing the detective work to figure out what's working, what's not.
Exactly. Yeah.
Because I look at your toys and I see why.
Yeah. Well, I'm impressed with what you do.
Well, I'm impressed too. I'm glad I came down. It was a great day. I appreciate it.
Yeah, and so it's not
Fly back
easy.
up.
It's not always easy to find doctors like us.
No.
Sometimes patients, have been searching, right, and
But they find you, right?
Yeah,
They
and
love
often the same is true, I'm sure, for you, where they've seen dozens of doctors before they found you, right?
Yeah. But one thing that we learned, we just had a case last week. He had seen 4 or 5 doctors. He was very frustrated with the information we were giving him.
Yeah.
Even after showing him the testing and things. And, one thing we tell them is, look, this type of scenario, when you're focusing on your body, it's very easy to get sick.
Yes.
Right? It was very hard to get well.
Yes.
And the pushback is always the journey when we say, this is what you need to do to get well.
Yes.
And we're not covering up anything. We're not, managing symptoms. We're going after the cause of it. And people have to get out of that normal mindset in order to see that. And so, we said, look, let me do a favor. Just come in for a week. I'm not even charging you. I know you're hurting. I know I can help it. Don't worry about the money. Just give me a week.
Yes.
And he said, no one's ever talked like that. And so he's coming in for a week, and he'll do it. He'll be fine. He'll be fine by the end of it. It was a referral.
Oh, wow.
And so, all referrals are always the best.
Yes, of course.
But he's going to come in, he's going to do treatment, he's going to do very well with it. But I think if you show that you care, this is also energy healing as well. I mean, we believe that too.
Yeah, of course.
Right? Your energy is going to be 50%. The
Yes.
treatments are all tools, but your energy is going to be 50%. And so our doctors are, especially the realm that we're in, we're the only ones that can do that. Right?
Yes.
And so we believe that too.
Yeah. So I'm gonna give a big shout out to you. What's your website?
VenturisClinic.com. VENTURIS Clinic.com.
And you're in Oklahoma City.
Oklahoma City. Yep. Heart of Oklahoma.
Yeah. And so I would invite everybody to support holistic, integrated medicine doctors that do cutting edge medicine like we do, right?
Yep.
With the ozone, the laser, the regenerative joint therapies, peptides. We're always under attack, right?
Yeah.
It seems like they always want to.
That's when you know you're doing something right, right?
Yes. So I would encourage you to support okkairos.com.
okkairos.com.
And MSIM.
MSIM, right.
Website here in our organization here in Maryland. Thank you very much.
Thank you, guys.